with me Elle Russ on the show today. Welcome, Elle. Welcome to Better.
Hi, so happy to be here. And it was such a great conversation with such great feedback of having you on the Primal Blueprint podcast when you came on. So
yeah, and we had, we can talk a little bit about your new podcast, which is really exciting. But yeah, had a really great conversation with you. And then we were chatting afterwards and I was like, you know what, you need to come on to talk about the thyroid, because my Betties, we talk a lot about how we can, we sort of have this blend, at least I like to think that there's a blend of ancient wisdom and modern science in terms of how we make better decisions for how we eat, how we move, how we think, for our families, for, relationships, all of that. And I think that the thyroid is such a poorly managed, especially when we're talking about this in the context of hypothyroidism, of Hashimoto's thyroiditis. So I think I'm really excited for this little, we're just gonna totally we're gonna have a little nerd out session today. So I'm really excited for it.
Hey.
I think as we're kind of wading into these waters of thyroid health and metabolism, one of the things I found so striking in our conversations and just in doing research for our show today is your own history. I was saying to you in the pre-chat, your we'll call it your discovery of potentially the shortcomings of thyroid management in the allopathic model. And I think that if you would be so willing to share your own journey with how you were feeling, what people were telling you, what the discovery was, and how you ended up kind of coming full circle and just healing thyself, doctor, like how you ended up sort of fixing it yourself. I think that would have set a really nice groundwork and pre-frame for what we're going to talk about today.
Yeah. So what I actually really am a great example of is you do not have to be an MD to understand whatever you've been diagnosed with, right? You can, if you understand it on a theoretical level, you'll understand it enough to be asking the right questions or know that you're with the wrong practitioner. But this is sort of how I became an accidental expert in this. And by the way, the other thyroid authors too, I only recommend two other thyroid authors, Jeannie Bowthorpe and Paul Robinson, who are also patients. And the best-selling thyroid books have been written by patients for a reason, because we know how it feels. We understand. We've done all the N=1 with the thyroid hormones, and we really understand what it's like. We really empathize. But on that same note, why is it that a doctor hasn't written the best-selling thyroid? Why isn't someone who's trained? What did they miss? Why do I know more than a doctor? That just seems crazy, but yet it's true like 99% of the time over the world. And it really is because doctors just weren't trained in the way that they should be. And so unless you're going above and beyond what you learned in medical school, such as a functional medicine doctor, naturopathic physician, chiropractor, people that are really geeking out, going above and beyond, constantly searching, those are the doctors that really are in the know about this. Not all of them, but that's where you're gonna get your best bet. So what happened to me was this is before paleo, primal, ancestral, any of this stuff came out many, many years ago. So I was like 30 years old, never had any gynecological issues my whole life. All the women in my family, perfectly healthy. And I was in the pursuit of acting career in Los Angeles. I'm still an actor. I still occasionally go out for auditions and stuff, which people find is pretty funny. But so when I first got here, that was my intention. And in order to be a leading lady in the Hollywood industry, not necessarily now, but it still kind of is the case, you had to be fit. Now, it was pretty obvious. Like, you go to casting director's office, you realize you have to look like an athlete if you want to be the leading lady. So that's what I did. And I thought I was doing it the right way by following sort of like the eat every 2-3 hours, keep your insulin sensitivity. The zone was very popular at this time. And so I was doing that, but I really wasn't sure what I was doing. I was probably eating a low carb, low fat diet, which was a horrible combination, as I know your Betties know. And I thought I was doing everything right because I did have the body, but I was suffering on the inside. I was obsessed with food. I was thinking about it all the time. I get so hangry and hypoglycemic. I couldn't even drive like from Hollywood to Malibu. It was like a 45-minute drive without freaking out in the car and like pulling over and trying to shove an apple and some meat in my mouth from the deli. Like it was just a struggle. And I remember at the time going, oh my God, I think I might have to go to Overeaters Anonymous. Like, I'm obsessed with food, even though I looked the pillar of like what you would see on Shape magazine at the time, like, oh, she's an athlete. And I thought to myself, is is everyone else who's fit also suffering silently? Is it just me? I didn't know there was another way to achieve it. I didn't know there was another way. So again, I was on a very wrong dietary paradigm. Now, who knows whether all of these things were the perfect soup to cause a thyroid problem? I have a suspicion that I had thyroid issues when I was a teen, then they might have resolved, then they came back, and some people kind of feel that way throughout life. So I wonder if I had some hypothyroidism sort of creeping up all along. Either way, my lifestyle and paradigm and eating schedule was certainly bad. And I was overworking out too. So I was doing chronic cardio. And then I just started to get an onslaught of symptoms. I started to have horrible acne and I had perfect skin. I straightened my hair today, but I have curly hair. My curly hair got loss of curliness. My hair started falling out in droves. I became so constipated, even laxatives wouldn't work. I mentioned about 40 symptoms in my book and I had about 30 of them. So they ranged anywhere from gaining rapid weight. And when I say that, I mean, you could eat nothing for 3 days and you've gained weight. So there's nothing you can do. And that's a horrible place to be because you're out of control. And you think that all of the things that normal people out there do to lose weight then will apply to you. So you do them, which is the wrong thing to do. And I'll get into that later. But essentially, it makes you crazy because you're trying to do all of the things that should work and they don't work. So rapidly gaining weight, any kind of gynecological issues. At the time, my hypothyroidism, and it often does with women, it will manifest itself gynecologically. So for me, at the age of 30, I started to get my period all the time, which is absolutely not normal. And I didn't know better at the time. So what did my Western doctor do? What every Western doctor would do. Let's put a pill on this. Let's patch this symptom, but let's not ask and investigate why is a 30-year-old with healthy and perfect gynecological history suddenly bleeding out of nowhere? Okay, so no one asked that question. I didn't ask that question. I was a dummy. Kept putting me on birth control pills. I kept bleeding through them. Tested my thyroid. Your thyroid's fine. Work out more and eat less. And he hit my gym shoes with his hand. I said, hey, buddy, I'm working out 2 hours a day. Do not tell me.
Right. It's like, there's no more room for working out.
There's no more room for any more working out or dieting over here. Yeah, he's like, well, it's not your thyroid. I asked him to test my B12. This one doctor, he patronizingly laughed at me. Turns out I had a B12 deficiency. So these are the things that happen. You get patronized by Western uninformed doctors who don't know better. And that's a really tough place to be, especially because when you are hypothyroid, you're an emotional wreck. So the symptoms range everywhere from like dry, cracked skin, diagnoses of polycystic ovarian syndrome, infertility, miscarriages often happen. Never get pregnant before you get your thyroid tested comprehensively. You do not want a miscarriage that doesn't need to happen. And everything from heavy legs, restless legs, exhaustion. The worst thing about thyroid, aside from the physical manifestations that are your body breaking down, because essentially the thyroid is the master gland of the human body, not because I said so, because it is. So it's in charge of the regulation and production of all of our sex hormones. It's in charge of our body temperature and fat burning T3, which is the biologically active thyroid hormone. If you don't have enough of that, it doesn't matter what you try to do to lose weight, you're not going to burn the fat. So when you don't have any of these things, you're slowly dying. I aged more in this time. I looked older then than I do now. You see it, you feel it, you wake up with a puffy face, puffy eyes. And there's a million symptoms in there. So this was like really horrible. And so I went to doctor after doctor. I went to over 24 endocrinologists, spoke with 12 of them, emailed them, would talk to them. 24? 24 in LA. So I live in Los Angeles.
24. Wow.
That's right. About 24. I met with at least half of them and then communicated with others. And I would know from communication that it was a waste of time to go see them. I paid $600 for a famous doctor from a Suzanne Summers hormone book to just test me correctly. And then once I was tested correctly and I realized what it was, even though everyone else failed to do that, I thought, you know what? Y'all failed me. I'm not going to do it. You're not going to tell me how to fix it because clearly you don't even know how to diagnose it. Yeah. And so that's when I turned to Jamie Bolthorpe and her free patient thyroid forum on Stop the Thyroid Madness, which was a Yahoo group before. And these fellow thyroid patients, just like me, had suffered for years, and they kind of guided me into a direction where then I was able to go and help myself and figure it out. And so I did. So I figured out and ordered my own thyroid hormones on the internet. No one helped me do this. No doctor helped me. And I fixed my first bout of hypothyroidism. Then a few years went by. I was doing well. I started to get hypothyroid symptoms again. And I thought, well, that's not possible. I didn't even think they could be hypo symptoms because I was on thyroid hormone replacement. Turns out I had what's called a reverse T3 thyroid problem, which is a sort of resistance to one of the hormones. So I had to go for the second time in 10 years and figure this out myself, bawling my eyes out in the car in the parking lot of the doctors who had said, this is too complicated. Literally had a doctor throw her hands up and say that to me. You don't want to hear what I said to her. No, but what I said to her was, what I did is I said, you know what, seriously? I go, so the MCATs weren't difficult. Medical school was not too complicated, but my situation's too complicated. Like, I was left in the dust by doctor after doctor.
Like, thanks for giving up on me. Like,
Yes. Yeah. Thank you. Thank you by the way, celebrities still see this doctor all the time and and I'm like, all right, well, you know what, if those people are happy, that's great. But I see what a terrible thing that was. So it was really awful and lonely. And again, I have a philosophy degree. Like, what? Math, science? So I had to figure it out, and I'm telling you, it's really not that hard to grasp. Once you understand on the level that I teach it at, write about, and have grasped it at. So then after that, on my second bout, I thought, you know what? Even more doctors are uninformed about this particular problem, really uninformed. And I thought, oh my God, I'm left in the dust again by myself. I have to do this again by myself. So I did. By myself, ordered my medication on the internet from other countries. Like, I shouldn't have had to go through all of that, but I did so that everyone else doesn't have to suffer for as long as I did. And some people suffer much longer, 2 decades, 3 decades. The thing about this that's so terrible is that it's 100% fixable. And I need to push this point home, because if you're out there and your doctor goes, well, yeah, I know you have depression, but you're hypothyroid, so that's a symptom. No, it's not. Here's the difference. When you are treated properly, you are no longer hypo. You don't have one single hypothyroid symptom. So if a doctor is chalking up one of these symptoms to say, well, this is what you have, that's a doctor who doesn't understand how to treat you properly or fix the situation. And then they'll put you on Prozac and it'll last 3 months, and then it won't last anymore because you never fixed the root in the brain, which was the T3. And we have more receptors here than anywhere else, which is another reason why when you get hypothyroidism, you often have these weird symptoms like messy handwriting. So brain to hand dexterity. I'm an athlete, but if I were to stop my medication right now and I'd become hypo, I would be bumping into things, knocking over my water, like really klutzy. And you're like, oh my God, these are strange things that happen. You also start to lose your cognitive abilities. And this is the one I like to mention because this is the scariest one that people don't like to voice. It's weird to have the thought that you feel you're getting dumber or older in the brain and then express it. You could either be depressed or have a general malaise. It usually starts with why even bother anymore? What is this all about? I don't even care. What's the point? And then it can, go further down from there. So it can be sort of start off with not pursuing your goals and kind of giving up on stuff and you don't care. And then it can really turn into serious depression, but also cognitive abilities. So while I am a fast talker and I'm bound to, bumble my words every now and then, when you are seriously hypothyroid, you either can speak like you're slurring words, like you're drunk, or you cannot find the words. You have sort of dyslexia of the mouth. I had that too. I started to notice I couldn't connect the words and you're reading, you can't retain information. And so you start to feel dumb and you start to feel like you're getting old, but it's a weird thing to express. So I like to tell everyone this because if this is you and you're feeling that way, that also is definitely a hypothyroid symptom. And, there's things like brain fog that people mention. And if you're out there and you're wondering well, what is that? I always say everybody listening has had a cold before. And you know how it is when your sinus is all stuffy and you're just staring into space. Nothing's fun. Your brain's not interesting. You don't want to watch a movie. You don't want to read. Like nothing's fun. You're just kind of brain dead staring into space. That's exactly what brain fog feels like without the stuffiness. And so, you can get car accidents, you're forgetful. There are people that have quit their jobs for fear of getting fired because their brain no longer retains their accountant and they can't remember numbers and it's very, very scary. And so I bring up those symptoms, the mental ones, because people are a little bit more afraid to express them.
I'm so glad you did, because one of the things I think that the pandemic has certainly highlighted is how much we disregard mental health. I mean, we, And we can talk about metabolic efficiencies, and we can talk about how that is, we often see comorbidities with, metabolically inefficient patients when it comes to things like the pandemic. But one of the things that we have absolutely sacrificed is mental health, and nobody wants to talk about it. We see increased suicidality in teens. We see increased mental health issues, and no one wants to say, like, to your point, I'm so grateful, your candid honesty, like, for you to feel like you're getting dumber. That's a really hard thing to admit, not to your doctor, to yourself. For you to say, I feel like I'm not as smart as I was. And so often, especially with women, it's like, well, that's perimenopause for you.
Right. Or it's like, well, I guess my Aunt Mary ended up recluse. Well, maybe Aunt Mary had some problems we never addressed. Like,
maybe she had a thyroid issue.
That's what I was saying. Maybe she's got Hashimoto's.
Right.
So and I say that because I was having this conversation on an interview, and one of my good friends who I've known for 10 years, more than 10 years, who's seen me through both of these thyroid bouts. Okay. I never thought about her having a thyroid problem until I get off the interview and I turn and she's crying. And I'm like, what? She goes, you just described. And it was all the mental stuff. She was too, and she had some recluse aunt that, like, she just thought, she lived in this private fear of maybe I'm just, oh no. And I looked at her and I was like, oh my God, I never thought to test you for thyroid. Like, we didn't even think about this. Well, we get her tested. She had Hashimoto's. I turned to her and I go, just be honest with me. Are you eating a ton of gluten lately? Just be honest. And she goes, oh my God, yeah, I am. And I go, all right, well, that ends right now. And we can talk about why that's important for people with Hashimoto's. Within 2 weeks, she deflated like 10 pounds, bright eyes, amazing hair, the most miraculous, change you've ever seen in your life, from just optimizing nutrients and cutting out and just following like a good paleothyroid type of protocol. And it was so amazing. It was like talking to someone who's listless and not there, and you kind of can't get their eyes, almost like a drunk person. If you're talking to a drunk person, you're like, they're seeing through them. That's how it is when you're talking to someone who's really in a brain fog or seriously hypothyroid. It's like you're kind of seeing through them. And I thought, oh my God. And she just lit up. And it was really, I think it scared the crap out of her, and
it's a scary thing to think your brain.
It is a scary thing. Yeah. Especially when you find out one day, like, what, I have an autoimmune disorder. What are you talking about? And also the day you find out, like, sorry, you can't eat gluten anymore. I mean, so it's really interesting, but that's why I talk about the mental stuff, because the mental stuff is what even my best friend who has access to me, and she had no idea that was such a component.
And we've had psychologists on the program. We've had psychiatrists. We had Dr. Kelly Brogan on maybe last year, and she was talking about, when she sees someone with depression, she will test for deficiencies first. She will say, like, B12, thyroid panel first. So often, and she was describing one patient who had, every time around her menstrual cycle would just have these psychotic episodes. And what they did was they were saying, oh, this is, related to her menstrual cycle. And it's like, yeah, if you actually look at some of the physiology that happens in the week leading up to your menstrual cycle, we see decreased plasma glucose, we see decreased plasma B12, zinc and iron and all the things, because your body is literally throwing all of these substrates into the endometrium to build it up. So she would have these psychotic episodes related to B12. So she started taking, and we'll get into I know we'll get into remedies today, but B12, magically, I'm using air quotes here, magically, got rid of these psychotic episodes. So I think that's really, and isn't really
that profound. Amazing? And, I mentioned Holly Perkins in my book. She's like a celebrity fitness trainer, and she talked about how she's in her 40s now. She's been on some kind of antidepressant or mind altering whatever since she was 11, always thinking she had issues with brain depression. And again, then you're so young, and then your family's like, sorry, this is just the way your brain is. And so this story is stamped in. She gets to become an adult. She does some tests. Turns out she just has a serious sensitivity to gluten, and I think it was dairy. She cut those two things out, and she got off of all the medications within a year, from spending her entire life since she was a kid with a story that this is who you are. You were, somehow your brain was formed different, or whatever this freaking story was. And it was just a story about two food groups that fixed it. So I'm not surprised. We've seen that happen with a lot of people, even just like iron. Iron can just completely fix everyone's problem. I mean, a dumb pill from the over the counter, right? So sometimes it's very easy. Sometimes it's more complicated, but either way, it definitely is fixable. So I want people to have hope, because I know people out there are like, I've been struggling with my thyroid. I get these emails, I've been struggling with my thyroid for 13 years. And I'm like, oh my God, why? Like that's wrong. That doesn't have to happen. And I want to share with everyone too, the biggest part of that is the ignorance on the part of the patient, which was my problem. Now, granted, I'll give myself a little credit. Back then there weren't podcasts. Okay. There was nothing out there except for these wonderful women who were thyroid sufferers on a forum. Now there are free podcasts. There are free thyroid guides. There's 100 interviews of me talking, there's access to the information. So the biggest gift or lesson I could give anyone is, if you're diagnosed with something, or you think you have a problem, or you've been diagnosed, please do not just drop that in the hands of any doctor. You also have to learn about it. The more you learn about it, then the more you understand how to have a doctor help you, the more success you're going to have, and perseverance pays. So that's what I do, is when I'm coaching thyroid people around the world, it's really like, of course, we're talking about their specific situation and what they can go back to the doctor and go, okay, this is the dose I think I need. This is what I want to do. But also it's about educating them so they understand their own disease. 25 plus million Americans have a thyroid problem. 60% are undiagnosed. 200 million people in the world have it. And the number one prescription in the United States is just one thyroid hormone. Most people, I'd be willing to bet money that 99% of the people that take that pill don't even know what it does. So what I find is that people are on thyroid hormone, and then 20 years, and then they're talking to me and they're struggling. And I go, well, did your doctor test that? Yeah, no, I'm sure they did. I go, man, I don't believe it. Go back and check. Every time, didn't test it. Turns out their thyroid's all screwed up. And then what do? And they're sitting there in a pool of tears going, oh my God, how could my doctor have failed me by having me on the wrong thyroid hormone dosage, not looking at this, not understanding for 20 decades. And you go, how did you go 2 decades not knowing and learning? It's because we trust a doctor to save us. And I'm telling y'all right now, please don't do that. They need to be our partners, but you cannot rely on them solely, because you will keep going through doctors that then can't help you.
Absolutely. So well said. I think that, I think that there needs to be better training for doctors so that we can better serve our patients. Absolutely. But on the other end, I do think no one is coming to save you. And for you to be delegating your health to someone else, and this is said with love, but it's foolish. When you are thinking that someone else is going to save you, and this is, I feel like this is, it's a life lesson. Absolutely. I think that it is so important for you to create self-agency. Okay. I think that I'm having this. I'm going to listen to a podcast from Elle. I'm going to do some research on DuckDuckGo. I'm going to do whatever. I'm going to find some of these forums and see if some of these symptoms fit, and be able to have, because your doctor, also in many cases, especially if they're not the functional medicine kind that you were mentioning, the DCs, the NDs, the FMDs, they're working on a timer, and no fault to them, but they got 10 minutes with you. There's no way that they're going to be able to extract that information and be able to understand your clinical picture to the degree that they should. And that's unfortunately just the system. So you have to take that responsibility. It's not, it's this idea of, it's not your fault, but it's your responsibility. Like if there's a baby that shows up on your door, it's not your fault, but it's your responsibility to take care of that baby, right? In the same way that if you have something that happens to your thyroid, or something, health-wise, it's not your fault, but it's your responsibility to figure out how you can move forward in the best way that's aligned with your core values and aligned with your health, your philosophical premises around health.
Yeah.
Okay.
And I'm happy to, if we want, I don't know how, I'm happy to get into detail, because, I want to give people detailed stuff.
Yes.
I don't want you to leave this podcast or this episode and realize you got enough information. You don't even have to read my book, right? I want to give details. So I don't know where you want to start first. I think the details might be best in describing the thyroid hormones and the whole feedback loop. And then we could get into tests and then dosing a little bit. And I can try to give as much as I can on those topics, or can go anywhere. that you want right now.
Funny enough, that's exactly what my itinerary dictates. So I wanted to talk about thyroid mechanics. So I wanted to, if we can give because I think that, you said he tested my thyroid when you were talking about your doctor. He tested my thyroid, and I didn't want to interrupt you, but I'm almost certain that he didn't.
It was just a TSH.
Yeah, exactly. It was just a TSH. Exactly. So let's talk about mechanistically what happens. So we have sort of almost two parts. We have like a brain piece and we have a thyroid and somatic piece. So speak to us about how thyroid hormones come to be.
Okay. So I'm going to be mentioning things like T4, T3, reverse T, like all these things, and they sound really complicated, but just trust me, if you have to listen to this over again, you'll get it. And also this diagram's in my book, but this is the best way to explain the way the thyroid works, I think. So you have at the base of your brain, something called the pituitary, and we can consider that in this situation, like a signaling center, a sensor of some sort. And when your pituitary senses that your body is getting low in the life-getting needed everyday thyroid hormones, it'll send out a signal, a wake-up call to the thyroid. And that wake-up call, the little that's sent, is called the TSH, thyroid stimulating hormone. It's not a thyroid hormone. It's a pituitary hormone.
It's a brain-derived hormone.
Yeah, and it is meant to just cast out a wake-up call to go, yo, hey, do your job, start kicking out some more thyroid hormones because she's low now.
It's a text.
Right, it's a text message. And I'm going to be describing it when the thyroid's working right, okay? And then I'll describe how it goes wrong. So then the message is sent to the thyroid. A normal working thyroid goes, great, thank you. And it pumps out two things. A lot of something called T4 and a little bit of something called T3. I'm going to stop right there and I'll explain what those two things are. So T4 and T3 are considered the main thyroid hormones, but one of them is only the one that actually does anything, kind of, called T3. All right. So what's T4? If T3 is the only biologically active thyroid hormone and those levels correspond to what we need, then why doesn't the body just pump out T3? Because T3 is very fast acting and it's very powerful. So T4 is a storage hormone for T3. So what that means is you can imagine it like a lovely slow release mechanism in your body. So the signal sent your thyroid pumps out maybe 80 to 90%. We're not totally sure, but that's roughly what we think of T4, maybe 9 to 20% of T3. And then throughout the day, as your body needs T3, the T4 gets stored and it converts as needed into the powerful fat burning T3. And then whatever's not used of that T4 that has not converted will get kind of flushed out, you can say, through a process called reverse T3. Okay, so we got TSH sends a signal of thyroid pumps out a lot of T4, a little T3 throughout the day. The T4 builds and converts as needed. Whatever's not used gets converted into something called reverse T3, which is the inactive form. Why would it do this? The reason it does it is such an elegant system. It's protecting you because T3 is like putting gasoline on a fire. Okay. So it's dialing it up and dialing it back. So let me give you a scenario where your thyroid's going to go, oh my God, pull it back. So for example, let's say you are starving yourself, you're anorexic, you're overworking out, you're undereating, whatever.
Having 1,200 calories and you're doing too much cardio.
That's right. You're that chick. All right. Yeah. Now in that situation, you are sending a signal to your system being like, she's starving. So what your thyroid does is goes, oh shit, she's starving or running from danger. Maybe both. We don't know. Adrenals are high, right? Adrenaline, no nutrition, no fat, whatever. It starts to dial this back. It will start to convert more into reverse T3 because it's trying to save your life. And it's like, she didn't have food right now. Don't give her any more of that fat burning stuff. Let's dial it back. So it's saving you there. It's also going to do the same thing. Essentially, that's why your body would give you a miscarriage in this situation too, because it's like, she can't afford to have a baby right now. You know, if a guy has thyroid problems and they have low testosterone or issues with, erections and stuff. Yeah, same thing. It's almost like the primal sense of your body's going, do not procreate right now. You guys cannot take care of a baby. It's almost like that. I know it's weird to personify a human body, but if we can kind of think about it in that way.
That's one of the primary functions though, I think, biologically. Yeah.
Yeah. So the signals we send with diet, lifestyle, sleep, all the things you preach, that is all a soup that creates a healthy environment for a thyroid. So here's what else can happen. The signal can be sent to the thyroid, and then the thyroid doesn't do its job and pump out thyroid hormones. Or signal is sent, thyroid gets the message, pumps out the right thyroid hormones, but then the T4 cannot convert into the thing that matters. Another problem, signal sent, thyroid that not only doesn't convert at all, but it then over converts into reverse T3. So here's the thing that happens. When you cannot convert the main hormone, T4 to T3, you can have something called reverse T3 hypothyroidism, which is what I had in my second bout, and it's on the rise. There are more and more people that are having trouble converting the storage hormone to the active hormone. So then what do you do in that scenario? There's lots of remedies for that, but the last resort choice would be to do what I do, which is take T3 only, meaning I completely dismantle the feedback loop that I just talked about, dismantle the middleman and the storage hormone, and take directly what I need. But that is not optimal. It is the last resort choice for a reason, because I have a human brain trying to decide when I need T3 or when I don't. And because it fluctuates and I don't have the T4 there to keep things steady, it can be problematic. It gets a lot of tinkering. It's a pain in the ass. I don't suggest it to anyone, but it is a lifesaver. Because if I could not take T3 only, I would probably be dead right now because I can't convert T4. So those are some of the issues. And if I miss something or want to clarify something within there, let me know. But essentially, that's how it works. Now, as far as tests go, these are the things that you test. I'm just going to rattle off the 6 main tests. Of course, I know you would suggest, Stephanie, to yes, get an iron panel, get your B12 tested. Yes, of course, all this stuff. But if you're like, do I have a thyroid problem? You get the following 6 tests. You always get them tested before 9:30 a.m. and do not take thyroid hormones before the test, no matter what anyone tells you. You take them after the test if you're already taking thyroid hormones. And so you go in fasting before 9:30 a.m. and you get TSH, free T4, free T3, reverse T3. And then you also always want to rule out Hashimoto's as being the cause of your hypothyroidism. So you would check TPO antibody, stands for thyroid peroxidase antibody, and test TG antibody, thyroglobulin antibody.
Both. You need both.
You need both because you can be positive for one and not the other. And she's so right in saying that, because some doctors, they only test for one and they miss it completely. Mm-hmm. Okay. So what is Hashimoto's? It's just a form of hypothyroidism that is caused by a faulty immune system. Your immune system makes a mistake and starts to try to murder your thyroid gland. Is this the same thing that happens with people with type 1 diabetes, right? Their immune system makes a mistake, starts attacking their pancreas, and they can no longer produce insulin. So that is, now there is some different modalities that happen with Hashimoto's, but essentially they feel the same. They kind of are the same. They are hypothyroidism.
Great. The lab ranges, do you, can we talk about optimal? Because for example, for TSH, I've seen labs where 5, they consider a lab range from 0.45 to 5.5, which, I've read papers that, having a TSH, thyroid stimulating hormone, north of 2.5 can actually increase, you have a 69% increase of, I'm not trying to be, I'm not trying to scare anyone, but I've seen papers where the higher your TSH is, 2.5 to 3.5, 69% risk of dying from a heart attack or stroke. So for me, my optimal lab range for TSH is much tighter than.
Well, I wonder I'm wondering about that in the sense that if they think over a certain level is because they would consider that hypo, and then therefore hypo is a disease state that does affect the heart. Is that the domino game on that one, or
potentially? I don't know I'm not.
That might be it, because yes. Okay. So let's talk about these lab ranges. So first of all, for TSH, it usually is 1 to 5, something like that. Mm-hmm. And so if a doctor is only testing that, so let's go back to this little feedback loop I described. If a doctor's only testing that, they're just testing whether the wake-up call was sent. I don't order a package from Amazon, not receive it, and then keep ordering it. That's what that is. You check tracking. Did I get the package? Did I get the T3? Is it converting? This is why you need the free T3 and the free T4. So an uninformed doctor, if you're listening right now and you've never heard anything about thyroid, you could even see, well, that doesn't sound freaking logical. Why would they just test the signal and not test to see if you're getting the package? So most doctors just test the TSH. That's a 1973 test. No doctor worth their weight would test that to gauge your thyroid. You never want to take thyroid hormone or anything from a doctor who just tested you on a TSH. Here's, for example, a Mark Sisson, or this happened to him. It also happened to someone else that I know who's kind of an athlete. They woke up in the morning, went to go work out fasting. Then they went to go get their annual blood work. And their TSH at that time was like 3.5. And the doctor goes, oh my God, we need to give you Synthroid. We need to give you T4 only. We need to give you, thyroid
after
hormone.
a fasted workout.
Mm-hmm. Now, this is such a big problem. And this is why we never rely on the TSH, because the TSH fluctuates all the time, right? Like if your body's low in thyroid hormone, you just worked out, then that TSH is going to be like, yo, wake up, wake up. So at the time of his blood test, it was like, yo, wake up. That's why we never go on that. However, it is an important factor. So for example, I had a friend whose wife just decided to go off thyroid hormone after like 20 years. I don't know why she did that. And we looked at her labs after that, and her TSH was 140. Okay. That's the brain screaming, like, please save her life. She's dying. She has 0 T4 and 0 T3. We were like, how are you alive? Okay. We got her back on thyroid hormone replacement. Thank God. So yes. So it's important because we can see it and go, ooh, that's not good. Like that means there's some screaming going on, but unless you're taking the other tests, you're really in the woods. You have no idea where you are. So we never rely on that. So where should a TSH be for normal people in this world? Again, if you just worked out and we're fasting and it's 3.5, you can't really gauge that. We'd have to look at the free T3 and the T4 on that. In general, it should be roughly in the middle of the range, like 2.5, 2, something like that. It could be a little bit below 2, whatever. It's the least consequential of the thyroid test. Now let's talk about free T3. So, and it doesn't matter where you are, because in Canada, the range could be 2 to 6. Mostly in the States, Quest Labs or anywhere, it might be 2.2 to 4.2. Let's just take 2.0 to 4.0, because that's a classic one in the States for free T3. Now, if you're not on thyroid hormone, you're a healthy person who has a normal thyroid, your free T3 number will likely be in the middle of the range at 3.1. Almost every time. Doesn't matter if I test Mark Sisson at age 68 or Brad Kearns or you or whoever it is, it's about 3.1. It's about right in the middle of the range. So if yours is a couple points below that, the doctor is going to discount you. If it's at the bottom, it's still in the range, they'll go, it's fine.
Low normal, still with the range.
They're not looking at optimal. They're just going, whatever. So it's a little low, big deal. The free T4 should also be roughly in the middle of the range, but the standard for that is somewhere around like 0.8 to 1.7 or something like that.
Yeah, 0.8 to 1.8 usually.
Is that about it? Yeah. So in that range, a normal person who's got a normal thyroid will have about a free T4 of like 1.31. Almost exactly. It's kind of pretty clockwork. If you test normal people not on thyroid hormones, it's 1.31 for in that range, and it's also 3.1 in that range. Now, if I have a friend who tested 3.5 in the free T3 range, and they were not on thyroid hormone. However, they suffer from anxiety and have very low body fat. It was an indication to me that perhaps they were a little hyper, or that had to do with it, because when they actually took low dose beta blockers for their anxiety and stuff, they felt better, which is sort of what they give to people with hyperthyroidism. So, again, too high, too low, but we're not talking about hyper overactive thyroid right now, although we can. So then your TPO antibodies and your TG antibodies. So those ranges are really different, but let's say for the TPO range, it would be like 0 to 35 or something. Well, if something shows up in there as a positive number, it's indicative of an immune situation.
I was going to say anything more than 0 for me is kind of a problem. Yeah.
Thank you. So people are like, oh, but my doctor didn't care because it's like, it's 14, it's fine. But that is tipping all of us in the know off to go, hey man, you got some kind of autoimmunity happening here. Because when you test me for the TPO, it doesn't give a result. It's like less than whatever. It's not even, it doesn't really show up. Right. So if it shows up at all, it's a concern. It's something to watch. Right. Oftentimes when people are really, and you can suffer there, by the way, you can suffer there and have normal free T3, sort of normal free T4. Things look kind of normal, but you've got 14 on a scale of 0 to 30. It's still pretty low. It's kind of the goal for most people with Hashimoto's to get that low. You could still be having some issues. And in that case, then you look at nutrients, you look at diet. There's a lot of people that have been able to stay off of thyroid hormone replacement through just diet and lifestyle management for Hashimoto's. So Hashimoto's actually has a better chance at being mitigated and controlled through lifestyle and diet and stuff than other forms or other issues. Not always.
Like multiple sclerosis or other autoimmune conditions, you mean, like lupus, things like that. Yes.
That's right. I mean, it really is, you can, if you nip it in the bud quickly, you can do it.
And there are many examples of women putting at least women I've worked with, putting their Hashis in remission through lifestyle verticals. Like we're going to talk about nutrition and sleep and movement and that kind of thing.
Absolutely. So, let's see, what else did I miss here? Okay, so we've got these labs. So then now those are labs for optimal, normal people that don't have any symptoms. Okay, so what are you looking for then if someone's on thyroid hormone replacement? And this is where doctors make a mistake because they're trying to emulate that it should look exactly like normal people's. When they're on that, you cannot compensate for, when you introduce exogenous hormones to the body, you are shutting down whatever system
feedback
is
loop. Yeah.
Right. Mm-hmm. And so when you shut it down, those numbers are not going to look the same. So there's a couple of nuances here. When you're on T4 only, levothyroxine is the generic term for that drug, but Synthroid is the brand.
Yeah.
When you're on T4 only, then you know what? If you're properly treated with it and you're doing well, which again, it often fails people, but it can work. And if it's working for you, then your labs are actually going to look somewhat similar to someone who's a normal person out there in the world. You will still have a TSH that's sort of normal. You're free. It'll look a little bit normal there, but not so for people that are on other thyroid hormone combinations. So I'll just gloss over and say that there are really 3 choices of thyroid hormone replacement. One is T4 only. Okay, so now if you've been listening to this and hear my feedback loop, so what you're doing then is that is not endocrine mimicry, because our thyroids don't just give out T4, they do give some T3, but it is the 1950 solution to hypothyroidism that most endocrinologists will do first. I do not suggest it as a first order of business some of the time, but some of the time it can be. So I don't want to completely rip on it. Sometimes people do very well on it. So there's T4 only. Then
but is that a lot? Can I stop you for a moment? When we talk about T4 as a solution only, what I have observed clinically, and maybe you'll also be able to provide some color here, is that works for a time. It's usually that is a somewhat of a Band-Aid solution. It works. It can work for many years, and then it doesn't.
Right. And that's where most people end up with that, which is why I say to start off with, it might not be great, but it could be. Someone might just need a little bit of T4. There are so many different nuances to everyone's, but some people don't need full replacement. Some people just need a little sprinkle, right? Some people need the full overhaul. So it just really depends. But yes, you are right. It often fails people. That's my problem with it. And also it's not endocrine mimicry. It really isn't. So
it can't account for if you have a conversion problem from T4 to T3 and all you're doing is giving T4. You're just backlogging the system.
You're hurting the person. You're actually, that's a terrible thing to do. That happened to me when I realized I had a reverse T3 problem. And I went to this doctor and I explained it. At the time, I went to so many, but this one doctor said, oh, well, we just need to give you more T4. I go, you don't understand. You're going to make it worse if you keep doing that. Right. You can't keep giving me the thing that's causing the problem. And I'll talk a little bit more about reverse T3 in a minute, because I think it is important. Yes. The important thing to know about it is that T4 is the only thing that converts into reverse T3, the inactive form. It's the only thing. That's why T3 saves my life, because it doesn't have to convert. It's the last choice. We want the conversion. I would love to be able to convert T4. So the second and best choice for thyroid hormone replacement is a T4, T3 combination. This can come in a variety of ways. Compounded T4, T3, what does that mean? Compounded pharmacist goes in, it's the least filler, the quote cleanest, you're allergic to a ton of stuff, or you really need to compound it down to the microgram. Let's say someone's like, I feel better with 2 extra micrograms. You can't break up natural desiccated thyroid, which is the other T4, T3 combo. There are a couple T4, T3 combos. We got compounded, where compounding pharmacists can do it down to the microgram. Then you can just use Synthroid and Cytomel, right? But those come in specific amounts, so you break it up and whatever, and you can't extract them. T4, T3, in terms of natural desiccated thyroid, T4 and T3 come locked together in certain dosages. And you can add and do some stuff with it. But if you wanted to get very exact for a particular patient, compounding, and sometimes people choose compounding because, again, they're very sensitive and allergic to certain fillers and things. So then that's the way to do it. And sometimes it's cheaper. So T4 only, T4, T3 combination in the form of compounded synthroid and cytomel or NDT. And then we've got the last resort choice, which is what I'm on, which is T3 only. Last resort, you've exhausted everything. You do not go there unless you have to. I'm here to tell you it's the biggest pain in the ass, and you do not want this trouble in your life unless you have to have it. But thank God it saved my life. Okay, so those are the main thyroid hormones, and you don't necessarily, like my book, The Paleo Thyroid Solution, is not about jumping on a thyroid hormones. It's like, let's clean it all up first. Let's clean up, optimize, do the things that you do with your clients and your patients. And then let's see, is it going to turn around? Okay, do we need to do more investigations? For example, do I have heavy metals? Do I need to clean up some heavy metals? Yes. Was I living in a house with black mold and that's how I got Hashimoto's? That happened to Dave Asprey from Bulletproof. It happened to someone else I know. You can go down the investigation train as to what caused this, what's contributed. Look, I had heavy metals. Okay, very high mercury, but I didn't discover that till later. Did that do it? Was that it? I've gone through every level of like cleaning up. And so you can go down this road and you can, but then here's the only problem that happens. You have someone who's been doing this for 5 years or 10 years. Now at this point, you can't even detox from anything, even if you try to, right? Your body's not working. So at this point, you do probably have to go on thyroid hormones, maybe temporarily, but you got to get on them so that you can get your body to a primordial baseline that is sufficient. Metabolism, enzymes are working, your temperature's correct, all of the things, you feel good. And then from there, let's do more investigating. From there, let's detox. From there, let's take 1,000 tests. But if you want to feel quickly, better quickly, sometimes you got to go on the thyroid hormone. Not for everybody though, not right away, but then you do talk to these people. And if you're like, I keep trying to fix it. You're like, oh, you've been hypo for 10 years. You're just slowly dying at this point, accelerated aging. If you don't get on thyroid hormones, you can't even fix the problems. Does that make sense? So it's too far gone to the point where you wouldn't even be able to clean up the precursors to it or the causes, even if you wanted. And that can happen to you. You go on thyroid hormone, you're unhypo. Now you do all the things, you clean out, blah, blah, blah. Now you're good. You're feeling good. You've been there for a while. And now you can go, let me try to get off it. It can take 3 months to recalibrate a thyroid. It's not once you go on it, that's the end of the world. I also want to say something too. People are always very afraid of, they're like, I don't want to go on a medication. I don't want to be on medicine for the rest of my life. This is, it's not really a medication. It's a hormone. You're giving your body what it needs. It still is technically a medication, but I differentiate them in terms of, the birth control to me is a real medication. It's something that is manipulating your body to do something it shouldn't do. And therefore it comes with a laundry list of side effects.
I would say the same is true for statins.
Yeah, 100%. And overprescribed.
Yes.
Shouldn't be prescribed to anyone that hasn't gotten a CAD score done. That's 0. That's a total disaster. Same thing here. Okay. So thyroid hormones are giving you, it doesn't manipulate your body into doing something it doesn't, it shouldn't do. And so I don't look at them in a dangerous way. Of course, I've been on them for so many years. It's really not anything to be scared of. And people can go on them and then get set and then wean off because again, now they've fixed all of the problems. How can you detox in a body that's slow, sluggish, has 96-degree temperature? You're constipated. You can't
methylate. You can't do anything. Yeah. You can't
do anything. Yeah. Methylation, very important. Of course, everyone get their MTHFR test and figure that out, get your homocysteine. So there are so many options. I've been on all sorts of different combinations of the hormones over the years. I've even been hyperthyroid, which is overactive. So I'll just briefly touch on that, which is Graves' disease is an autoimmune disease that normally affects the thyroid in a way that makes you hyperthyroid, like overactive. And at first people would think like, oh, this is really great because, I'm so skinny and I'm pooping all the time and I can't even gain weight. Well, you're could die in a minute because it affects your heart in such a horrible way. It can give you a heart attack. It also makes you hypermetabolic so that you actually will end up being hungrier. Your blood glucose will get screwed up and then you will actually get fat. It'll backfire. So this is the backfiring thing that like bodybuilders do when they're getting ready to burn fat for a competition and they take a bunch of T3 because it's a direct fat burner. They have to offset it because too much T3 is catabolic to the muscles. So if you're a bodybuilder trying to do fat, you're going to jam yourself with T3, you're going to shoot up and do all sorts of other stuff to offset the catabolic nature. But it says a lot that that's what they take for a potent fat burner. So then people go, let me just go to the direct.
Just more of that. Just more of that.
Just give me more of that.
Yeah.
Now you're really asking for trouble because we really are Goldilocks. We're not too hot. We're not too cold. It's minimum effective dose. So I had a person who came to me from, I coach people all over the world because this is no different in Australia than it is in Saudi Arabia. It's really the same everywhere. I think uninformed doctors. And
the standards of care seem to be the same too. It's like, oh, here's some Synthroid. Like, it's like, it doesn't, and that's part of the reason why they only do TSH, because it's actually not going to change the way that most doctors behave in terms of their prescriptive patterns. It's still going to be Synthroid. Yeah. Yeah.
Yeah. And so this woman in Australia, she was like, I started doing T3 with my doctor, blah, blah. I started to feel better, but then I started to get tired. So I took more and she just like kind of kept taking more. And that also can exhaust you. So people think T3 is like cocaine or caffeine. It's not, guys. It's not. Yes, it's an energy hormone. It's not feeling like you're jacked up, like you've got too much energy. T3 helps people sleep. There are people that maybe can't tolerate T3 late in the day. There are some people that take it right before they go to bed, like myself. So again, that's another mischaracterization of that drug. People think, that it's going to give you a bunch of energy. It'll actually wear you out if you're on too much. When you're hyper, you get exhausted quickly.
Right. And I think what you're talking about generally with T3 is how we might look at bioidentical hormones or hormone replacement therapy, right? This is, as you mentioned, it's endocrine mimicry. You're trying to replicate homeostatic, you're trying to honor the feedback mechanisms and how these hormones naturally occur in the body. Now, granted, T3, we're bypassing that T4 loop as you mentioned, but the attempt is still there. The attempt is still to have somewhat normal thyroid function. It's not for a specific, I don't want to get pregnant, so I'm going to take a contraception that's basically going to cut off my brain. It's going to chemically castrate me from my brain and my ovaries, we can kind of, I've done many podcasts on the birth control pill, so we don't have to go down that rabbit hole.
And it's possibly what led to me being hypothyroid, because I was on it for 10 years prior, and it does rob you of your thyroid hormone and of your testosterone.
Yes. So. And B12 and CoQ10 and mitochondria. Yes. So all of
CoQ10, I had a deficiency and a selenium deficiency. By the way, before we get into that stuff, I do realize I want to close out the discussion on what labs should look like.
Yes.
So let's say you are on a T4, T3 combination. One where it's like full thyroid hormone replacement. So I'm not talking about the people who are just taking like a tiny little, like a little tiny something, but people who are like, oh God, I'm seriously hypothyroid. I've got to get on thyroid hormone. When you're on T4, T3 combination, this is fully replaced. This is how the labs often look when you are optimized and you have no more symptoms. Now, this is not what I'm about to tell you is not something you target. I'm just telling you, it's usually what happens. The TSH will go down to 0.01, which freaks out any other doctor. And I will tell you why they freak out about that in a second and why it's wrong. And you probably already know that about me from the audience. So the TSH will probably go down to 0.01. The free T3 will be above the mid-range, sometimes towards the top of the range. So if someone's at 3.9, and I could, for example, I have one friend who's at 3.9, that's where she has to stay to feel good. A doctor might go, oh my God, you're hypothyroid. The top of the range is 4.0. It's not gauged the same as it is for people on thyroid hormone replacement. Okay. And if everyone's temps are good and all their vitals are good, then that's what's right for them. But that's usually what it looks like. It's above the mid-range or towards the top of the range. And then the free T4 you don't really want it to go over 1.4 in the range that we talked about. When it starts to get above 1.4, that can be indicative of an issue, the brewing with reverse T3 and some other things. But usually anywhere from 1.2, 1.3, 1.4, something like that in there. So that's what it'll look like when someone is optimized on NDT or a T4, T3 combination of Synthroid or Cytomel or of compounded. Now, the caveat with that though is if someone's just taking 15 milligrams of an NDT, that's not going to do all the things I just mentioned. I'm talking for people that are pretty much on full thyroid hormone replacement. And that's really what those labs look like. So the reason doctors freak out about the TSH is that back in the day, they used to, in order to get rid of nodules on the thyroid gland, like 40 some years ago, they used to do this thing that they don't do anymore, which is that they would jam the patient with a bunch of T4. And it got rid of the nodules, but what it did is it made them hyperthyroid. Okay. You don't want to suppress a TSH when you're on T4 only. So what I mentioned about these labs right now are just for T4, T3 combination people. You never want to see really a 0.01 TSH with someone on Synthroid, T4 only. And
just
again,
T4 only, yes.
Right. So that would be a red flag. So this is what they used to do to
so
try
T4
to get rid of
only,
thyroid
just to clarify, T4 only should approximate normal optimal labs. When you're on a Synthroid, when you're looking at your lab work, it should look approximately like the optimal ranges that we started with. But now what you're talking about is this NDT, this natural desiccated thyroid, or compounding. We're going to see we're going to see different labs. We're going to see a lower TSH, which would be normal for that for that cohort, for that population.
Here's why it's more normal. And I want to explain this. Like, why would you not want someone on T4 only to have a suppressed TSH, let's say, but it's okay for someone on T4, T3? This is why. T3, again, is the biologically active. So when you swallow T3 directly, the pituitary, the signal, the TSH goes, I don't need to do anything. I'm going to shut up. And my shutting up is 0.01. I'm shutting up. You guys obviously have it figured out. I don't need to do my job anymore. I don't need to wake up my neighbor anymore. They got an alarm clock. That's why it's 0.01. But here's why doctors freak out. When they used to do this protocol back in the day to try to get rid of the thyroid nodules, what they found is that those people got hyperthyroid. They had heart indications that were not good. They were losing calcium. And so because of this, I'm just going to say it, a dumbass uninformed doctor is going to go, oh no, we can't have, I had a doctor tell me that I was going to give myself cancer, have a heart attack, get osteoporosis. You know what? The patients in my doctor's practice with the lowest TSHs on NDT have the best bone densities. Okay. This has nothing to do with it. You're gauging apples and oranges. We do not gauge them the same way.
Why context is very important. Context is so important.
So important. So that's what it kind of will look like on a T4, T3 combination. Again, if the person is like taking a substantial amount. If they're not, then they may still have a TSH. And again, you don't target hitting 0.01 ever. It's just that most people that are optimized on fully replaced thyroid hormone end up having those labs. And sometimes you can be on a little bit of armor, a little bit of this, a little bit of that, and still have normal thyroid, TSH, and stuff like that. It just really depends on how much you're taking. But that is how that would look. And then doctors get even more freaked out when you are on T3 only and they see the labs, because there will be, and again, this is not someone who's just like swallowing 5 micrograms a day, but someone who is literally like, okay, overhaul, we're taking it over. When you're on T3 only that way, your labs are going to look frightening to a doctor because it's going to be a very suppressed TSH, even more suppressed than 0.01. The T4 is going to be about 0. You're not going to have any T4, and your T3 might be even above the range. And that freaks out everybody who doesn't know what they're doing when they see that. But here's the truth. As far as we know, there is no evidence out there to say that we have to have T4. Is it helpful? Is it the best way to do it because of the endocrine mimicry? We want the T4 to be doing its job. 100% we do. But is it necessary? No. I've been living off of T3 only for more than 13 years now, I think. So people say T4, oh, well, you need it for your brain. You need it for your hair. I have a huge head of hair. I have a really big brain. I've written several books. I'm highly functional. I haven't seen the need for T4. Now, recently I did, and I can't give the evidence on it yet. I will. After all of these years, I decided, let me try to take a little T4. And so for the past 2 weeks, I've taken 12.5 micrograms, which is the lowest dose you could take of T4 in the morning. Why? Well, it's not enough to probably cause a reverse T3 problem because I take T3 the rest of the day. And
which
T3
was your original problem, was your conversion, like T4 was just going right to RT3.
That's right. So it's a Scotia dose. We tested it out. We'll see what happens. So far, it does seem to make things a little steadier. Again, and this is the problem with T3 only. Okay. Slow release or not, it's the last resort choice. So even though I take it, I don't want people to run out there and go, I'll just take T3. You really do want a T4, T3 combo if you need thyroid hormone replacement. And it would be the most ideal place to be if that works for you. And if not, then you have to go to the last resort choice. So, I mean, I remember I went to a doctor and when they looked at my T3 only labs, they were like, oh my God, you're going to have a heart attack. You're going to kill yourself. You know, they just don't know what they're talking about. Now, you do have to check vitals. They say so much. And this is what you can do at home. When you're checking your temps, when you're monitoring pulse, when you can check your own blood pressure, this is how you gauge at home what's up with you. You know, this is how you can gauge, ooh, maybe I'm too much. Maybe I need to dial back this week, or maybe I need to go get tested. You know, I haven't been feeling right. Oh, my labs are high. I'm waking up with a high temp. What's up with that? Ooh, I feel too warm. I'm clammy. Maybe I'm on too much. You know, there are lots of indicators for overstimulation and indicators for under, and then we've got labs, and the best is your own N=1, like how's my pulse? How do I feel? What are my temps? I always go to the temps. I always have my thermometer around. Do you know what I mean? To just kind of gauge things. Because if something is off, you know, you can kind of tell through temps. You really can assess adrenal insufficiency and also thyroid insufficiency through just temps alone. So there are things you can do at home to kind of monitor this. Once you get on your right dose, usually if it's a T4, T3 combination, you kind of you stay there. You might need to make an adjustment for like a little bit more in the winter and a little bit more in summer, a little bit less in summer if you live in a place that has extreme seasons. But usually once people finally reach their optimal dose, they don't have to tinker around too much. Maybe when they hit menopause, they'll have to change a dose. But again, you kind of stay steady and you're good to go until something feels off. And then when something feels off, you go right to the temps and track basal and afternoon every day. And you look at some things and then you go get the blood work and maybe you're like, oh, I need more, or that looks like I need less. What I have found out over time is that I need so much less T3 to operate off of than I used to when I was probably not as healthy and metabolically efficient. So I was once on 100 micrograms of T3 per day, which is it's a pretty high dose for most people. And let's see, what do I do now? 10, 5. I'm on about 15 micrograms a day, plus a little bit of that T4 in the morning. I've go between 15, 30. I've kind of been in there for a couple of years, some tinkering, but for the most part, I've never gone really high with the dose. And I believe that's because I was just so metabolically broken and screwed up in every way when I started this whole thing, that as I went down the journey of cleaning up, doing the heavy metals test, okay, now I'm doing this. So now I need systemic enzymes. Okay. Then every time I needed to keep reducing. I became more metabolically efficient. Now on this note, let's say somebody is an athlete, they're super, metabolically efficient in the paleo world, maybe they're keto, carnivore, whatever. And then you get their thyroid tests and their T3 is low, like 2.2. And you're like, are you okay? And they're like, I feel great. In that case, you have to go with I feel great. If they have zero symptoms, then that means that Ben Greenfield is just super extra T3 efficient. And he showed his thyroid labs, and I think that's what it is. They're very low. But he's also got extremely low body fat. I think he fasts all day except for one meal. I mean, he's extremely efficient metabolically, so perhaps that's not a problem.
He's also a male. He also has a testosterone. Yeah.
It would be a red flag to me if I saw that, but then I would be asking the questions. Do you feel this? Do you feel that? And if they're like, I feel freaking great, I have no hypothyroid symptoms at all, then you're like, wow, then you're good with that low T3. Then I guess that works for you.
That also makes sense. If it's a fat burner and he has very low fat, I mean, that would make sense that the body would, again, this is the elegance of that feedback loop. Like you don't want T3 jacked. If you are at, I would probably guess Ben is, 4 to 6% maybe body fat, something like that.
Yeah.
Yeah.
You're absolutely right. So that's another case where you wouldn't be alarmed. Do you know what I mean? But you ask the right questions, but if they're like, I'm good, you're like, all right, then you're just T3 efficient. So when I say that, there might be a patient on a T4, T3 combination whose T3 is in the middle of the range and not above or not towards the top of the range, and they feel great there. Then that's okay too. We always take in everyone's personal experience. You're never trying to hit a mark. You're never trying to hit a target. This is so individual. There are a vast array of the way people dose thyroid hormones. There is no right or wrong. There are only a myriad of different choices the way people do it. Sometimes people do what I do, take a little bit of T4 in the morning with T3 the rest of the day if they've had a reverse T3 problem. Sometimes people take T3 only and they take it every 5-6 hours. They take it 4 or 5 times a day to kind of do an even spread. But then there are people that take 75 micrograms twice a day, which would probably kill me. But you know what? That works for them. There's some people that take their T4 at night. So however people have come to these N=1, there are some standard ways to go about doing the dosing. And it's all fixable. So if you have not been fixed yet, then someone's missing something with either a lab test. And if you're perfect with your diet and all the lifestyle stuff, then it probably is the mismanagement of not putting you right on the right combination or right dosage of thyroid hormones, or both. Another mistake I want to point out that patients and doctors make, and this is really important because this happens all the time. People come to me and they're like sobbing because they ask their doctor, can you test these things? And the doctor goes, great. And they get to the lab, they get their blood drawn, and they get the results back. And I'm like, where's your reverse T3? My doctor said they would test. Did you check the lab slip? I'm sorry that you have to do your doctor's work for you. Do not go into the lab. I know you want to believe that when they said, yes, I'll test that. But you know what? They don't. They go back to their office and they go, they don't know what they're talking about. Or they go, I don't know what reverse T3 is. I'm not testing it. And they don't test it. So you need to look at your lab slip before you go in there to make sure that they tested all the stuff. This will save you a lot of time and frustration. Yes. Another mistake that patients and doctors make is a doctor will give someone an entry-level dose of a thyroid hormone. You can never pummel someone with what you think their right dose would be. We all start at a minimum, and you have to build up to the right dose. That's how thyroid hormones work, no matter what thyroid hormone you're on.
It's like makeup, ladies. A little bit. Do a little bit. You can't undo a black eyeshadow. Just a little blend in, little.
Yeah, just build it up. Build on it. So hilarious. So same thing goes with thyroid hormones. So this is the mistake. A doctor will give someone an entry-level dose of whatever, okay? And they'll go, hey, come back in 3 months or 6 months. Nope. Because here's what happens. You introduce the exogenous hormone. It's going to start to shut down the TSH, and then they might feel more hypo than they were before they came into your office about a month from now. And then they go, this is not working. I feel worse than I did. And they stop taking it and they blame it. This happens all the time, guys. You have to go back every 3 weeks until you reach your optimal dose. Most doctors would go 3 weeks. 3 weeks is enough time to see what the T4 is doing. It's enough time. 4 weeks max. I would never go beyond 4 weeks. So someone gives you 30 milligrams of NDT to start off. You go back, you get tested in 3 weeks. That blood's drawn. It's going to take a week for the blood to get back. Now we're at 4 weeks. Boom. You need to up the game. You need to keep climbing up the ladder. So you're going to probably need a new dose at that point. And now here we go again. And we're going again. And we're doing this until we reach your optimal dose. Doctors need to do that. You need to convince your doctors to do that. Get tested on your own. I don't care. At some point, you have to start dictating how you want to be treated and what you are doing for your own health. So that's a huge mistake. I've seen too many people who've taken an entry-level dose and then like a year later, they're still on it and their doctor never called them. They didn't know, blah, 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 blah. Please don't make this mistake. You have to get tested every 3 weeks when you start thyroid hormone, not necessarily with T3 only. That is a different ballgame. But when it comes to T4, T3 combinations particularly, and I would say even with T4 only, if you're on Synthroid, I would still test 3 weeks later and go, what's this doing? And do I need to up it? Do you know what I mean? So that's how you kind of catch the, because you take 2 steps forward and then you take a step backward when you stay on an entry-level dose for a long period of time. You can even become more hypo, and you can have hypo symptoms show up that you didn't even have before. And then you think, oh no, I'm getting even more hypo. And it's not true. Another thing that happens that I just thought of that's a classic one is people will be like, oh my God, I'm on too much, my heart. And you're like, what's your heart rate? It's totally normal. Usually that feeling with hypothyroid patients, like if people lay down and they feel this thumping in their chest, they're like, something's wrong with my heart. Like I can feel it. They hear it, feel it bumping. It's usually low ferritin and or adrenals, but it's usually low iron storage, guys. It's not your heart. T3, your heart needs T3 to work right. Usually if you were to test your pulse, you're not having a heart, it's not really that high. It just feels that way. The other thing too is when people start taking something with T3 in it, and this is why you do want to just start off at entry-level doses and dose properly, but they'll feel a little bit of a surge of energy that they've never had before. And they might get a little concerned, like, oh no, it feels like I drank a little bit too much coffee. Is my heart? No one's going to die off of 30 milligrams of NDT. And trust me, no one's ever I've never seen any overdose situations happen here. it's just an uncomfortable, weird thing to suddenly feel energy again when you haven't for a while.
Right.
So those are some of those weird things that happen. Another symptom I just want to mention that I didn't mention before is heavy legs or restless legs. Restless legs are often associated with low ferritin. So is tinnitus, ringing in the ears, by the way. But what does this feel like? This is also usually hypo and also a low iron thing. It's horrible. I've had it several times during my bouts. It feels like when you're walking up steps, you are carrying like cement bricks as legs, just heavy legs. And if you're experiencing this, you just know what I'm talking about. And that also is usually related to ferritin. So
ferritin, just for my Betties, this is the iron storage. This is like the amount of iron that you have stored up.
And the reason iron labs and iron levels are so important for thyroid is just imagine it like this. Thyroid hormone, whether you're taking it or your body's pumping out the right amount, can't get to where it needs to go without proper iron. And this is where I mentioned before, sometimes iron is all that's needed. I fixed a patient with just iron. I was like, you don't have a thyroid problem. Yeah. They called me back like a month later. They're like, oh, I feel freaking great. I was like, yeah, because you were headed towards anemia town. And this is awful. So this is why it's very important. Most doctors don't understand this connection. This is why ferritin, iron storage, or getting a comprehensive iron panel with TIBC, total iron, percentage saturation, and ferritin is important in this game. Here's why. You get a pill of NDT and you're trying to go up the ladder. You are going to have problems increasing and being able to tolerate it. You can do them together. When I first started on thyroid hormone and NDT for my very first bout many years ago, I had to take a crap load of iron at the same time as I was not at the same dosing. You always have to keep them separate, from each other in terms of timing in the day. But I had to pummel both at the same time as I went up. You're never going to get better if the iron storage isn't proper. And by the way, so that range usually is 10 to 150. If the range of ferritin that you have is 10 to 150, you're looking at 65 being a good amount. If it starts to edge below 40, side eye, red flags. When I passed out and had horrible heavy and restless legs, it could be at 30, edging down. I've been at 10. When you're at 10 towards zero, it was awful. I passed out everywhere. I was lightheaded. It was just a total disaster. So in order for thyroid hormones to work, whether you're swallowing them or your own body's giving to you, you need to have proper iron storage. And women lose a lot of blood in, menstruation, and also maybe had some babies, blah, blah, blah. Did you have a surgery? Usually we're not topping it off. If you're a vegan or vegetarian, you're not eating iron, you're not paying attention to stuff. B12, like is a very important factor with all of this. So it's very important to have those. And oftentimes that's the missing link. Like it's just that one thing,
Let's talk a little bit about the wives' tale around the constipating, the constipating effect that supplementing with iron can have. I think it's very important. The form of iron is very important. I would love for you to expand on that.
My favorite form, and the form used by most thyroid patients and authors that I know, is ferrous bisglycinate chelate. Is that what you're doing? Yeah. So that's usually the one of functional doctors as well. So iron has many forms. Yeah, ferrous glutamate, ferrous sulfate. The old forms of iron are what led to those wives' tales about issues with constipation. It doesn't do that at all. The only symptom or side effect I've seen in anyone, including myself, with iron bisglycinate chelate is that your stools will turn black and they will look like black tar. And that's totally normal, but that is the only weird thing that should happen. Other than that, you should just only get benefits from it. It is important to take away from thyroid hormone only because it can render the thyroid hormones less effective. So you just want to you want to get the most for your money on each thyroid pill and everything. So you take it, 2 to probably 4 hours away from thyroid if you really want to be careful. I had such low ferritin. And here's the other problem with ferritin too. If you're very low and you're around 10 or 20, it could take months to get up to 65. So
yes,
it is
very
one
good
of those
point.
things you have to regularly, I tell my clients, I'm like, do not drop the ball on this one. I don't care if you miss the vitamin C or you miss something else. Do not. I don't care if you have to set an alarm. You have to. So what you want to do is and there's lots of ways to dose the iron, but, you can check every maybe 4 weeks and just kind of see how you're doing, but it could take months. So you don't want to drop the ball on that. Like, you don't want to just be like, oh, I took some iron for a couple of weeks. It should be fine. No, not going to do it. That one takes a while. Vitamin D is also another one that takes a while. And let's just talk about that because it's related to Hashimoto's and everything, which is vitamin D on a scale of 30 to 100 should be about 70 to 100. Everybody should be targeting that, particularly in a pandemic. I still take 5,000 IUs of vitamin D almost every day. And I live in California in the sun, and I'm in the sun all the time. So it has nothing to do with that. But most thyroid patients are deficient in vitamin D and B12 and some other things, and iron. And it's because when you're hypo, your body kind of can't hold on to these nutrients. So that is why hypothyroid patients are classically low in iron. And they're like, but I'm eating liver. And you're like, it doesn't matter at a certain point. That's the thing about it. So if you were on thyroid hormones and you're taking iron together, you're like trying to fix this problem, you've got low iron, and you go up this ladder, at some point, your iron gets up to 65, let's say on the ferritin anyway. You remove the iron, and by that point, hopefully you're on the right dose. Now you're not hypo anymore, and now you're like a normal person where your body holds on to iron and you don't need to take it. You still need to check in with it, but you don't need to take it regularly. So you could get your iron up and do that, but then if you're not fixing the thyroid problem at the same time, great, you got your iron up temporarily, but if you don't keep taking it, it's just going to drop back down. And you don't want to be supplementing iron forever, and you also don't want to overdo it. Most people are not going to overdo it with iron, and if you did, you could always go get give blood.
Correct. Yeah, you could go give blood. If you're menstruating, you can menstruate. You can have your period and get rid of it that way. But if
people, especially if you're a vegan or something, then maybe it would be like once a month on 1 or 2 bleeding days, you take a iron glycinate, take an iron pill. But if you're a regular meat eater and you're getting good iron and nutrients, like I haven't taken iron for a while, I'm getting my labs soon. I'm sure they're great. What's interesting though is right around my period though, I do sense a little bit of restless leggies just for that moment. And I'm wondering if it's even just like a psychosomatic body thing going, hey, we want to give you a symptom you know is associated with this. Make sure you get some liver, make sure you take an organ pill, make sure you know what I mean? So occasionally,
I think I can't, like when women are bleeding, like when they're menstruating, one of the things I often talk about is like, you need like blood building foods when you are bleeding. Like you need liver and you need red meat and you need to be having lamb and all of these things that are going to build back up your iron stores. I call them sort of blood building foods because we lose the blood, and you do that for 40 years, let's say. And so this is also important for my perimenopausal women who are still menstruating, and then women who are menopausal as well, because you can menstruate for 40 years, go into menopause and be deficient because you haven't been thinking about this. And we were talking in the pre-chat, I was like, well, maybe we'll get to veganism, maybe we'll be able to talk a little bit about, food choices. And I think that this is where it may be benefit, like, if you want to, we've had conversations with Rob Wolf and, I've talked to Brian Saunders and like lots of people around, some of the, like the ethical and the environmental, sort of verticals of veganism. And we don't need to get into that now. Like if that's the choice that you've made, like, bless you, like it's your choice. Like I am going to support, but you also have to, in the same way that you might take therapeutic T3, consider taking therapeutic,
methyl B12 folate.
Right. Or you might consider for a time having some meat as a therapeutic intervention. Yes. Some vegans, are very receptive to that. And like, this is what I need to do for my body to stay optimal. It has been my experience, and I don't know if you want to comment on this, but I have never, for the long term, I have never seen it done correctly. It's often they end up with a plethora of nutrient deficiencies, B12 being a really important one, iron being really important. Vitamin
I don't know of any lifelong vegans that are healthy. I've only seen it last 17 years when the person was meticulously on top of it.
Yes.
But then it only lasted that long until the doctors were like, can't do it. Mm-hmm. I have a vegan user friend to this day. She still holds her nose while she shoves turkey meat in there because she's still disgusted by everything having to do with it. She does it medicinally. because she knows she's not going to be able to have a kid or live a good life. And I said, well, after 17 years, I was like, oh my God, I'm so sorry to hear this. Like, this must be horrible for you to have to do this. Yeah. And I said, she goes, night and day with her energy. She's like, night and day. All the B12 supplements, all the crap she did, all the perfect cooking. They grew up with a private chef. Her mom was like, we're doing this right. 17 years. Another great author, Tovar Cerulli, he wrote a book called The Mindful Carnivore, a vegetarian's hunt for sustenance. This is way before the carnivore movement. He wrote this book like over 10 years ago. Tovar's great. He was also, again, probably like a raw vegan for like 17 years or so until it fell apart. And he wrote a book about, if I'm going to do this, then I'm not going to kill by proxy. I want to see what it's like to hunt and actually do it myself. And so it's sort of his journey of sort of learning about this. So a couple things about veganism. You have to supplement with B12. It is a choice, but here's the truth. You're making a choice against your DNA as a human being. You are literally making this choice. I'm not saying it's wrong, but that is the truth. And when you go against what your DNA expects of you, you're going to run into problems. And this is why, perfect example, before the pandemic, I belonged to a gym that had a pool right next to the, like locker room with the sauna and the steam. And I used to swim with a woman who I knew was a vegan. And one time she was kind of trying to insinuate that I was like an awful person for, eating animals, whatever. So I just let that go. We swim with each other. One day I'm in the sauna and she comes in out of breath in her swimsuit from the pool. She's like, I can't breathe. I can't catch my breath. I don't get it. I swim all the time. I don't know. I can't even do one length. And I looked at her and I go, you are still a vegan, right? She goes, yes. I go, when's the last time you took B12? And her mouth dropped. She was like, oh my God, you're right. We get out of the sauna. I write down exactly what to get. I'm like, you go right to she goes there. I see her 3 weeks later at the gym. She's like, thank you for saving my life. That's what happens when you don't attend to the things that we're talking about. So you can make this decision and that's great, but it is going to affect you in some way if you're not calculating these things, amino acids, other things. Yeah, I've never seen it really work out well. And also the ethical argument doesn't work very well. There are also people that are natural carnivores. They cannot eat plant matter. Not everybody can be a vegan. It's an elitist position to say that. It just doesn't work for some people. Like biologically, it just doesn't work. They can't eat plant matter. So what are you doing? Telling them they're awful people? What are you telling the family that's living in the, outback somewhere with yaks in South America, like that they can eat Beyond Burgers and veggies every day? So it's just, that's not viable when we talk about that. But if it's a personal choice, make your personal choice. Like my friends that are vegans, or hey, you can be paleo and not eat red meat. You can eat fish, you can eat eggs, you can do whey. I mean, there's ways to mitigate this. But if you are going to choose to go against your DNA, please be careful. Please be attentive.
Yeah, I want to reiterate something that Rob Wolf said on the podcast, and it really stuck with me afterwards. It was something that you just said. If they have yaks in the background, like it is very much a we'll call it cis white male, yes, Eurocentric North American. Like we should all be eating plants. And he was talking about, some women in some countries where it's first of all, it's very rocky, very mountainous. You can't have like these huge soy crops and corn crops, but they're not allowed, like women are not allowed to own property, but they can own livestock. So they can, that is that's their social status. That's how they trade. That's how they support their families. So we're going to just come in and say, hey, you got to be vegan because that's better for the planet. I mean, we can,
which it's not, which we know
it's not, but it's also incredibly sexist, because there's these people that cannot, this is their social structure. They can't they can't buy farm and grow corn on it. They can own cattle, yaks, whatever it is, camels, whatever. And so I think that there's, as you were saying, it's your choice, and I will honor your choice, and I will support your choice. And I will, as you said, I'll tell you the B12 that you need to take and the dose and how you're going to do it. But keep your opinions to yourself about how everybody should be eating.
Right. It's because it is a personal decision, and it is not an environmental or ethical decision, because vegans, vegetarians, raw vegans would be horrified to know that how many large animals are murdered to protect their soy fields. So, that's the truth. And this is where Tovar Cerulli, the mindful carnivore, came in. He goes, we had an organic garden. And what we realized is we did everything we could to not kill stuff, but you can't get away with it. So even your lettuce, if you're a vegan, something has been killed. You may not have done it. Maybe it's organic herbicide. It doesn't matter. Something has to die. You cannot escape this life cycle. It's elitist almost to think that we can get out of this prey, predator, model. We really can't. You can choose to leave it. That's fine. But again, it's really going against the DNA. I am totally supportive of people doing this. It's just, what are your reasons? Because some people will go, oh, well, you know what? I hate all these like cow feedlots and stuff. And that's why you don't eat meat. Then please buy from regenerative agricultural farms like Rep Provisions and other places that are supporting the environment, that are doing the right things for the animal. That is what the paleo primal movement, Rob Wolf, that's what we all are encouraging. So if that's your only argument, that doesn't hold up either, because you can get your chicken pasture raised. You can do these things. And so I also hear a lot of people who miss things. They're like, I really miss barbecue chicken. Yeah, the Beyond Burger thing kills me. It's like they make this thing look like it bleeds. It's got all sorts of crap in it. It's like maybe soil and green. I don't know what's in there. And then you're like, but if you're craving that taste, that means something. That is a signal from your body saying, please do this. I had a friend who was pregnant, and she was a vegetarian, and she had dreams during her pregnancy of like putting her hands into like raw ground beef. And she woke up one day and she goes, maybe I need a burger. We're like, yeah, maybe you need a burger. She's not gone back since. It's like her subconscious mind was being like, please don't do this to your child. Please don't do this.
Right.
The body will send you those signals. You crave stuff. If you're craving it, there's a reason for it. And if for some reason you're going to do the alternative, but you're still craving burgers and you're eating a Beyond Burger, then you might want to check some, a list of nutrients, right? Because perhaps you are deficient in iron and you're definitely not going to get it from there.
And I would argue also, chemical toxicity. Like I would be thinking about your detoxification pathways, because you are consuming so many compounds that your body has no idea what to do with. Yeah. I wanted to circle back to something that you said earlier that, and I want to make sure that we get to this. I want to do a little bit of a deeper dive in reverse T3. So one of the things that you talk about is looking at the free T3 to reverse T3 ratios. So if we have a patient, let's say they're on NDT, they're on natural desiccated thyroid, and you're doing lab tests regularly, and we see that their free T4 now is creeping up. It's like 1.4 or north of that, nanograms per deciliter. Is that maybe an indication that we're starting to get some reverse, where we see T4 starting to increase? We're starting to see some reverse T3 potentially problems coming up.
You have to test the reverse T3, but if someone was on NDT and their free T4 was like 1.6 or something, it would be a big red flag to test the reverse T3, and I would guarantee that at that point they're on too much, or there's a reverse T3 and they could be just on too much T4, on too much NDT. But it would definitely be an indicator of it getting above 1.4. If it's at 1.4, usually that could be fine. That's where a lot of people are at when they're optimized on MGT. But if it starts to go up above that, that would be a red flag. Yeah. So Janie Borthorpe, she doesn't do the ratio anymore. She just goes, oh, hey, we want it in like the lower part of the range and blah, blah, blah. I still do the ratio. I look at both. So there's an online calculator for that. I can't do math, So there's online calculator that you have to put in the units of measurement first, between the reverse T3. And you can also do total T3, although again, free T3 is usually best. But if the reverse T3 range is usually, let's say like 0 to 30, if it's like 20s and up, now here's the thing, a ratio of 20 and higher, once you do the calculation, is usually anything over 20 is great. But if it's 17, does that mean someone's got a horrible reverse T3 problem and they need to go, no, they probably just need some selenium. Maybe just wait a minute. 15 and higher can be an okay ratio number if the person has no symptoms, but that's kind of creeping into symptom territory. So again, we're not just going off of a number. We're going on, how do you feel? Are you good? But when that ratio gets down to like 11, like it was with me, and my reverse T3 result was like 34, you know what I mean? Yeah, well, that's like glaringly obvious. Now, When there's a reverse T3 problem and someone's on T4 only or T4 T3, does that, okay, so if someone's on T4 only and they had a reverse T3 problem, then it would be like you dial back the T4 and add T3. So essentially put them on some combination first and see if that solves it. If someone's already on a combination of thyroid hormones and they're not being overdosed, they're on the right dose, but oh man, this thing's converting into RT3. Do you need to put them on T3 only right away? Maybe not. That could be a case for, all right, we're going to keep your morning dose or do a little T4 in the morning with some T3 and then do T3 the rest of the day. Let's see how that goes for a while. It could be just reducing the T4 and increasing some T3 a little bit in their dose, which might have to be compounded or you got to shimmy sham with cotton pills. So it's not just because someone's got a reverse T3 showing doesn't mean you throw T3 only. That is, again, the last resort choice. You do other things. Let's look into like what's causing this, right? It could be selenium deficiency. It could be stress. Are you going through a legal battle with your horrible ex-husband? And yeah, that can cause a reverse T3 problem in people that aren't even taking thyroid hormones. That's the important thing to know. And that's why the lifestyle stuff you preach is really important, because our mindset, our sleep, our lack of wherewithal, and overall just, like what can we deal with when we're super stressed out, that is also sending that signal to dial back, to convert more of the T4 into the T3. So any kind of hyper stress, physical or mental, can do that. I got a reverse T3 problem right after an extremely stressful 6 months of like going through some legal battle that I knew that I would prevail, but it was one of these awful things I just had to go through. And it was like just a really nasty thing. And you know what? When I look back on that, I go, oh, I was going through that at the time I got reverse T3. I also had a selenium deficiency. Could that have caused it? Maybe. I had heavy metals. Could that have caused it? Maybe. We don't know, because I got rid of some of those heavy metals and I still have a reverse T3 problem. So again, you can do all the trying you want. The good news is you'll probably be the cleanest, healthiest person after all of it. Will any of it solve your thyroid problem? Maybe not, but at least you cleaned it all up and that's what led you there. So reverse T3 stuff is on the rise. You always have to test it. The doctors that don't test it just don't know what it is and they don't know how to evaluate it. And again, the answer is not always T3 immediately. You try some other things first. And that's the tinkering you can do. Let's lower this T4. Let's add some T3. Oh, that didn't work. Okay, let's cut out most of the T4, keep a little, and do mostly T3. Oh, that's not even working. All right, now we're removing the T4 and we're, so there's lots of tinkering and ways to do it. There's been people that have looked good on NDT, felt pretty good, had good labs, and had no reverse T3 issues whatsoever. But something wasn't right. And for some reason, they went on T3 and that did it. I can't say that that's wrong or right. Would I prefer everyone to be on a T4, T3 combo if their body can handle it? Yeah, because it's the most endocrine mimicry. It's the safest, it's the best, it's the steadiest. But there are a lot of these cases where they're like, this doesn't work for me. And there's no clinical evidence to say why or that they should go on T3, but they do and feel better. So that's always an option too, but it really is a last resort choice. And you want to exhaust so many other possibilities before getting there.
I would also think too, when you think about conversion of when we're thinking about, the way that T4 is converted to T3, a lot of it's done in the liver. And then we also have conversion. What is that? Say it again.
Yeah, I think in the gland and other organs. I mean, it's
so like the muscle, the heart. We have that a big proportion of it is done in the liver, and then you also have getting slightly technical here, but we have T3 sulfate, and then we have T3. So it's triiodo thyroacetic acid. So like T3S and T3AC, which are both inactive, but they become active T3 in the gut. Of course, that's done by sulfatase, which is intestinal sulfatase, which is, of course, if you have a healthy gut microbiome, you're going to be able to take these inactive forms of T3 and move them into active T3. Is there, in your experience, and this is where sort of the...
By the way, real quick on the gut thing, when someone has severe... First of all, almost all thyroid people have gut issues.
Almost all of them. And co-infections.
Totally.
Yes.
Candida, everything. I had it too. Here's why, just for the people out there. So everything's slow, sluggish, right? Hyper, low heart rate, low temperature, you're freezing, all that. You're constipated, slow.
No acids, nothing.
There you go. So what happens is you start to chew food, you're creating less hydrochloric acid. It's not breaking down the stuff. It's not breaking down the nutrients. Your gut's already compromised. You can't hold on to these nutrients. They're not absorbing. This is how you get into this game. oftentimes when you're hypothyroid, no matter what you eat, you're bloated, you're gassy, it's a disaster. There's candida. Like it's just a total nightmare. I've been through it. And the gut needs T3 to heal. That's the truth. Yeah, for sure. So it's really important. And thyroid stuff can really screw up people's guts. But on the gut note, if someone had Crohn's or colitis or like a serious extra problematic gut issue, then that is where potentially taking your NDT or T3 sublingually can be helpful. I don't always recommend this. In my first book, I told everyone that I used to take my T3 sublingual, which I did. I do not anymore. I believe swallowing it is best. However, if someone's got like a severely compromised gut at first, they might want to take certain doses or some sublingually. So that just could be an option for somebody. It's not necessarily like the do it all the time thing, but there are people that do that.
Amazing.
And you can do that with most of the NDTs. You can chew them up and let them dissolve under your tongue. But again, usually reserve that for like serious Crohn's, colitis, awful gut things that are really brutal, because again, it may not be absorbed as well as it's going to be absorbed in your mouth.
And that's generally been my approach. So when I'm dealing with a thyroid patient, one of the interventions that we usually spend a lot of time on is liver detoxification, methylate, like amping up methylation, and then of course helping to reseed the gut so that we have better, we're reducing the intestinal hyperpermeability in the gut. We're helping with the gut dysbiosis. So I wanted to maybe touch a little bit on foods, because I'm a big proponent of a therapeutic intervention of the ketogenic diet. I actually like with, and I hear this all the time, and I'm going to cue this up for you because I'd love to hear your answer to it. But so often I actually like to initially remove a lot of plants. So I initially will sort of put them on more of a might be considered more of a carnivore-ish type of like nose to tail diet. I've seen, I don't have a lot of good studies. I have a lot of good clinical evidence and anecdotal evidence that seems to really work for some of my AI patients, particularly my Hashimoto's patients.
Exactly.
So I like to do that. And then as we're sort of helping open up these detoxification pathways, we're helping to reseed the gut. Then I like to bring back plants. I wondered if you had any comments on that in terms of a lifestyle intervention. If someone's listening, like, frick, man, like this is me. I got the cognitive decline. I've got the constipation. I've got the hair loss. I've got all these things, and maybe they're working with a functional medicine provider and they're getting the natural desiccated thyroid or whatever combination is going to be working for them. In the meantime, as a parallel, what would be some of your best practices in terms of actionable items, in terms of, you mentioned gluten, but like what would be some food, like a macronutrient constitution perhaps, or a diet that you might be recommending?
I mean, I always say start with a standard ancestral model and then you go from there. So the standard ancestral model would be, some would say high fat, moderate protein, low carb. Some would say high protein, moderate fat, low carb. Some might go moderate fat, moderate protein. But again,
we're all moderate protein there. And it's just a little bit of whether the high fat. Yeah.
Right. But low carb. So what does that mean? Well, that means unless you're Michael Phelps or an Olympic athlete, you are really not eating more than 150 grams of total carbohydrates a day. And if you're 5'2", like I am, I'm a small person, so where do you start at? I say, just start to gauge your carbs at first. We really don't know how many carbs we're doing. We don't know what's in stuff. A baked potato has 64 carbs. A pint of blueberries is 14. Do you even know? A green drink with seems like a green juice, that's 27 grams of carbs. You're going to drink that in your day of 80? These are things you have to think about at first. So if you can, you can program your stuff and program your macros in, but I think it's more important to just kind of focus on carbs first. Let's kind of lower that. I'd rather have people even overeating protein or a little fat, but I'd rather have them really lock in the carbs and the types of foods. So I'd rather have you not eat canola oil, but eat a shitload of fat. Like I would, so we want to eat, so you look at a paleo food list, of course, paleo ancestral. I love your approach to this. And I think that's important if people are highly inflamed with Hashimoto's and, autoimmune issues. I would sometimes start with the one that most people could tolerate. It's very hard for people to even accept any kind of restrictions. So you can start with the AIP, the autoimmune protocol, a paleo one. So what does that mean? Well, people have found that if you have an autoimmune disorder, you have issues with foods high in histamines, for example. So you have to look up foods high in histamines. Well, what's high in histamines? Leftovers. It's not even a food. It's a type of timing on food, right? Cinnamon. You put cinnamon in a coffee every day. Did you know that was high in histamines? Like
Avocados are horrible for histamines. Yes.
Avocados. There's eggplant, tomatoes, So these are the things. So look at an AIP food. Let's start there. Clean it out, clean out the cupboard, blah, blah, blah. Then maybe you dial it down even more. I mean, this is what happened with Paul Saladino, the main carnivore doctor guy. He got rid of most of his eczema, went through a paleo thing, got clean. And then when he went off all the plant stuff, it really went away. So you might want to graduate there first, because here's the thing, like if you can do AIP and get away with it, well, that's a lot less harsher than going right to a carnivore-ish thing. But again, you might have to. So I have a couple clients who have to be carnivore. One of them eats like one peach, forget about it. I mean, one leaf of lettuce, Crohn's is back. Like, look, this is their experience. They feel great when they're carnivore. What are you going to do? Argue with that? Like they're doing it right. Mm-hmm. So there are some people that just can't, but you might want to graduate there or start somewhere on the AIP first. At least start low carb, start paleo. But if you have an autoimmune disorder, paleo AIP for sure. But again, you might have to go to a stricter, like what Dr. Stephanie's talking about, which is like, you got to really pare it down and go off all of it. Carnivore can be extremely therapeutic. I've seen it work miracles in people. Like it really is amazing. I mean, how can you deny when someone's like, I haven't had an intestinal issue for a year and I feel great. Like, what are we going to do? Tell them to go eat an apple? No, don't eat a freaking apple. Just keep eating the liver. I know some carnivores that have experience with it, and like they'll have one macadamia nut and then their leg breaks out and welts. Well, that says everything you need to know about that for them. It is an N=1 experiment. For example, I took a food sensitivity test and it said I can eat garlic. Well, I can. I have a horrible issue processing foods high in sulfur. So I, will projectile vomit if I eat too much garlic. Am I going to follow a list or follow like what I'm feeling? I have no allergies to dairy. I'm part Scandinavian. But if I eat dairy, I get a little mucus forming, like stuffy, because 65% of the population doesn't really deal with it well. Well, that's my indication. Like, all right, don't do it that much, right? This is why singers don't eat dairy, like Mariah Carey, Celine Dion, all these people, Adele, they're not eating dairy, not close to when they're singing, they're not, because it is mucus forming for almost everybody. So, these are the things you just experiment with. I do think all of these diagnostics are helpful. I thought the food sensitivity test I did was helpful. Thought the organic acids test I did was helpful. The heavy metals test. I mean, yes, but you have to get with a functional practitioner or someone like Stephanie, who's going to be able to take you through, be able to order some of these tests for you. Your local doctor on your insurance down the street, they don't know anything. In fact, Kaiser Permanente as a whole doesn't even test free T3 at all. They just don't even test it. So, sometimes you do have to go outside the box here. I will say this, when I ask people how valuable their health is to them, they're always like, oh my God, invaluable, no worth any amount. But then they're not going to go pay $600 to go see a functional medicine doctor that's out of pocket because they want to stay in their PPO with a 15-minute doctor that's going to tell them they're stupid for looking at B12 and they have no problem because they tested TSH. You're going to get your money's worth.
And I would also say, just statistically, it's highly unlikely that you're going to find a really high qualified doctor who just happens to be down the road from you. Just happens to be. I mean, maybe that is going to happen.
I live in like Los Angeles.
Right. So you have to do, I think this is, such a good point that you keep coming back to, which is the responsibility of the patient to really do their due diligence. And the jurisprudence around this. I think that's important because the likelihood of you finding just the perfect match for you, who's just, has their shingle up down the road, is there's a low statistical significance.
I live in downtown, I live in Los Angeles, right? So millions of expensive, amazing hormone doctors. I drive 2.5 hours up the coast to see my doctor in a small little town, because he's up there. And it's hysterical almost to me. I'm like, that every time I drive to see him, I'm like, I can't believe I'm leaving like the land of medical whatever to go to where no one would think the right guy is. Dr. Right. Gary Forsman is my doctor, and he's also the doc on my book. And for those, by the way, I have a free thyroid guide on my website, just free stuff that kind of lists all the tests I talked about and, the protocol or what questions to call up and ask a doctor's office to maybe suss out whether they're an idiot or not, or it's not all foolproof, but there's some things in there. And again, or just re-listen to this this episode and write these tests down to get tested properly. So that is available for anyone if you just want to go like download it, or you're like, oh, I missed what's the list of tests. And then, finding yourself a functional doctor, someone like you, anyone who's going above and beyond a naturopathic doctor, but a normal, and by the way, endocrinologists are the worst. They are the most indoctrinated. And that's what's really crazy, because everyone will be like, well, I need to go find an endocrinologist because I'm dealing with something with the endocrine system. And yet they are the most uninformed on that endocrine system. I mean, it's almost comical. It's like a dark comedy, Stephanie, because these endocrinologists are the worst. They are the most indoctrinated. They have the highest level of ego. And furthermore, the Endocrinologist Association wants everyone's T3 in the middle of the range, no matter who you are, what you want, or whatever. So they're going to tell you no on so many things because they want to see it there, and they're not budging. So they are the most indoctrinated, and they're usually the worst people to see for these things. Unfortunately, you do want to get a DO, naturopath, someone like you, an MD who's a functional medicine doctor to figure it out.
I would say, and endocrinologists and psychiatrists, those are sort of, they don't, you see, God love them, right? But they are the only branch of medicine that does no testing before they write a script.
And I have talked to people, this was personal. I was actually set up with a guy who was the head on a date with the guy who was the head of the psychiatric at a hospital. And I was like, oh God, I'm going to ask him this question and I answer it wrong.
Your brain's like, don't ask him. Like, no, I have to ask him. Yeah.
First of all, he was kind of crazy. He was on psychiatric drugs or something. I almost felt like I should call the hospital and be like, have you checked into that guy lately?
Right.
So, but anyway, I asked him, I said, so before you put someone on Prozac or, an antidepressant or something, do you do a full thyroid panel? What do you think his answer was? No,
absolutely not. They don't think about
test anything. It tests the TSH. So here's the thing. You're being put on an antidepressant that won't work. It will only work for 30 days and then it won't work anymore because you never got to the root of the problem. They cured depression with what I take every day to stay unhypothyroid. You can fix depression by just giving someone, throw some T3 at a person. If I threw 5 micrograms of T3 at a person who was having a bad day and they didn't have a thyroid problem, they'd feel better. I mean, I'm not saying to go do that, but they would. A couple hours,
it's true. There are more T3 receptors, I think estrogen receptors and T3 receptors in the brain. Yes. Yeah.
Than anywhere else. Yeah. So that's why it goes back to all those cognitive issues. So yes, I was horrified by this. It is malpractice to me. It is horrible that any psychiatrist would put anyone on anything for depression without testing the underlying causes of depression. Number one being a thyroid problem. I mean, or B12, right? Or what these things we're talking about. And again, pills usually aren't the answer. And again, that's a pill that's doing something to your body that's sort of not meant to happen usually, which is why it does come with, it's interesting that antidepressive drugs have side effects of suicidal thoughts.
Or make you more depressed. Yeah.
Isn't that fuck? It hurts me in my heart and my brain to know this. You know what I mean? Yeah. When why are they just giving people T3? Or isn't there something else? Or let's test these people.
Or maybe we want to validate the
same goes for hormones. Yeah. So I had an example, and this is a perfect example. I had a 25-year-old kid come to this guy. He had horribly low testosterone, so the doctor just gave him testosterone. Wrong answer. Now that doctor should have been like, why does a 25-year-old boy, a guy, have low testosterone? Let me check his thyroid first. What do you think happened? Of course, he had a horrible reverse T3 thyroid problem. So in that case, if you just fix the thyroid, the testosterone comes back. He's a kid. It'll come back. When your lipid panel is all screwed up because you're hypothyroid, by the way, it will be. Your lipid panel will look terrible when you're hypothyroid. And then your doctors will be like, you need to cut off the saturated fat. And you're like, F you, dude, it's the thyroid, whatever. Once your thyroid's fixed, your lipid panel becomes normal again. Because again, when you have low T3, you're not processing fat. You're not processing any of that stuff that's coming.
So you have triglycerides spilling out into the blood system and you look like you're, atherogenic. Yes.
You look like a mess. Right. And, all of these things, are kind of off. So those are just interesting. And again, same goes with the mind or anything else. You always look at the thyroid. So if you're not in menopausal, perimenopausal years, doctors will just throw hormones at you like, you have a hormone imbalance. Why? Why do you have the hormone imbalance? Yeah. Why did I get misdiagnosed with polycystic ovarian syndrome, which I never had after that, never really did have? It's because hypothyroidism is a disease state that caused me to have that temporarily. That doesn't mean it's a life sentence. So what was that gynecologist going to do then? He was going to treat me for the thing versus going, why does she have it? When I figured out myself why I had it, the hypothyroidism, and I fixed that, I have never had a gynecological problem since. Never had an issue. Yet that mofo was going to be treating me with metformin and whatever. Again, patching. So if you want to look like a freaking quilt, and you get all patchworked up, but it's not going to be cohesive, and that's what these doctors do. So, and then, it's funny, that same doctor with the PCOS thing, I was in the steam room at a gym at that time in a different city here in LA. And I heard these two older women talking about doctors. I couldn't even see them in the steam room. And they mentioned the doctor's name who I'd just gone to. And I was like piping up because I'm like, and one of them was like, oh yeah, he did my hysterectomy. And then was like, he did my hysterectomy too. And I thought, oh, I'm bugging out of here. Like,
out of here.
Uteruses left and right, probably. And now, was he a dummy doctor? Did he misdiagnose me? No, the ultrasound looked exactly like somebody with polycystic ovarian syndrome. The problem was the question wasn't asked why. And the understanding wasn't, oh, we can fix this in another way. We don't need to just keep patching the symptom of the problem that showed up. Let's get to the problem that showed up. And so that happens with hormones. So and I had doctors do that to me too. I was a hormonal mess as well, right? I was bleeding all the time. I developed a fibroid in my uterus, a polycystic ovarian syndrome diagnosis. Like I was a gynecological mess during this time many years ago. And I remember one doctor was like, you should take progesterone. You should do this. You should do that. It was actually a Chinese medicine gynecological surgeon from China who's an acupuncturist, very famous one in LA. That doesn't work. She's retired. She looked at me and she literally broken Chinese, didn't even, write in English. She was just like, no, progesterone. Like, no, get you. She was the one that was like, you actually need thyroid hormone. She was the one that actually was like, this is what you need. And that obviously fixed it. So these are the things that happen. And, if you just get lost in it or someone's just trying to do patchwork, you're not really getting to fixing what caused it, Yeah.
Yeah. Really, really well said. Man, I just looked up at we've been chatting for 2 hours. Oh my God.
It's a juicy topic.
Yes, such a juicy topic.
We haven't even scratched the surface. That's what
I have so much more. I have so many more notes and so many more points that I wanted to chat with you with. And I think what I'd love to do is to have you back on the show, because I think that and I was saying to the student in the pre-chat, you are so passionate, so articulate, so well versed in thyroid function, but you also really talk to confidence. And you talk about self-care. And I think that is also another topic that I think is related to testosterone and related to thyroid in so many ways. So if you are okay with it, I'll officially ask you on air to come back and we can continue this conversation with thyroid, and we can merge it into and marry it into a conversation around self-confidence, self-care, and how we can begin to, take up more space as women and men. But, my audience is primarily women.
I want to mention one little caveat I thought of, so we're talking about hormones really quick. There's a little bit of a thing. So when you're menopausal, let's say, so there's more estrogen will naturally bind with some of the thyroid hormones. So sometimes before menopause, people need a little bit higher amount of whatever dose they're on of thyroid hormones, and maybe a little less after they go through that process. But there could be changes there that are related to that. So that's just a soup over here that could have some nuances to it. I just want to throw out to people. But anyway, yes, let's talk again. And this was a good one.
I know. And I think that, we can actually start there. We can start with sex hormone binding globulin. We can start with estrogen. We can start with all of that as it relates to thyroid and menopause the next time that we chat. And we'll figure that out once we stop this recording. So tell me, so people are inspired by you. They want to find out more about you. We've talked about your book. Where can people find you?
Yeah, the best place is elleruss.com. And I have a couple of free things on there. I have a free thyroid guide. I also have a free audiobook of guided meditations and affirmations. One is on healing. The other is on abundance for the guided meditations. And then there's 2 affirmation tracks as well. That's completely free. And I coach people all over the world, not just in, solving their thyroid problems, but I also do writing coaching because I'm also a writer. So I mentor people. If people want to get a book done, I work with them privately. And I also do a 8-week writing class. And then I teach a confidence course. And I, of course, life coach people, just wanting to up their game, be high performance individuals, or whether it be someone like just looking to, not be a stay-at-home mom and want to start a business or something. So anything involving like encouragement, right? Self-esteem, like Yeah, that's all the coaching that I do. And then of course, specifically with the writing, and that's a different ballgame. But yeah, lots to offer, and you can find it all at elleruss.com.
And you recently also transitioned after being the primary host on Primal Blueprint with Mark Sisson. I think like what, 500 million downloads, something like that.
500 episodes and 20 million downloads. And I was the host for about 7 of the 8 years we had it. I worked for him for a decade. He was my mentor. He's a wonderful man. And I recently just sort of branched off on my own. They sold the company to Kraft Heinz a couple of years ago. So, sort of moving onward and upward. And yeah, so I have the Elle Russ Show, and you can get that on elleruss.com or just ellerusshow.com. I've released a bunch of wonderful episodes already, and I definitely will have you on in 2022 to talk more on that platform. But that's really fun, and that's everything. That's just, I had Brad Thor, who's a New York Times #1 bestselling, thriller author, on, to a woman who wrote Celeste Headley wrote a book about Let's Talk About Race. So just really a wide variety of people coming on to talk about minds, everything to make your life better and more fun, really.
Awesome. Well, we'll have all of those as clickable links in the show notes as well. Elle, this was just I knew we were going to have a geeky magic carpet ride. We totally did. I'm so happy that you spent the time. Thank you so much.